Healthcare is too expensive. Employers are offsetting costs onto their employees. Who will make health benefits affordable for hardworking Americans and their families? You will. This is the Empowering Plans Podcast, a show dedicated to helping you once again emphasize the benefit in benefit plan. Now prepare to learn, plan, save, and protect with the FIA Group.
Hello, everyone. Welcome to another special edition of the FIA Group's Empowering Plans podcast. This is a podcast about COVID-19, the coronavirus outbreak that we're dealing with. I am Brady Bizarro, your host for today. Along with me is someone special who's not typically on our podcast, but I've asked her to join us to talk about some of the issues that we're seeing come up in our consulting inbox from our clients, really across the whole industry. And that person is Kelly Dempsey. She is the Vice President of Consulting. Say hello, Kelly.
Hello, Kelly.
Awesome. You got that one down, Kelly. That's the right response. So you're stuck with us two for the day. And what we're going to talk about on this episode, really covered this a lot already, I feel like. But every day there's something new happening with this outbreak. There's new legislation passed. There's new questions that were being asked. There's new guidance being issued from agencies at the state level as well. And so what I thought we could talk about today is, as we've been on the air, the House of Representatives just passed this sort of phase 3 relief package called the CARES Act, which I'm not sure I have the acronym down, but it's the Coronavirus Recovery Act. And it's a massive spending bill. It's $2.2 trillion. And it's really going to impact every area of our life the same way that the actual virus has. And so I wanted to talk about just briefly some of the things that's in this bill. And as a side note, we'll be having a webinar on this bill in much more detail. So feel free to listen into that. But basically, this is really a historic bill that passed. There's actually some last minute shenanigans that went on and almost didn't pass today because, as you might expect, there's so many lawmakers in DC, there's concerns about them all being in one place. And there was one member that was insisting that everyone be physically in the chamber for the vote. And there was a chance that might not have happened, but turns out they did get there in time. They did pass it just now, and it's heading to the president's desk, and we expect he'll sign it either later tonight or over the weekend. So what's in this bill? There's 6 major areas in this bill. I'll talk about a couple that are relevant for our industry, but $560 billion for individuals, form mostly of cash payments, which is, I think, the first time I can remember, or certainly one of the only times that the government has issued cash payments to some people who qualify to help them, for those who've been laid off or furloughed, who have lost their jobs. The next biggest slice of the pie here, $500 billion for big corporations to help them in this area, especially those like the airlines and hotels that have been impacted. Small businesses are getting a bunch of money, $377 billion. States and local governments are getting about as much as that as well. And then most importantly, perhaps for us, is $150 billion for public health services to help relieve some pressure on the hospitals and the physician groups and the clinics that are dealing with just an influx of patients. So there's going to be a lot in this bill. We're going to talk about it a lot more in detail. But just for a second here, I want to talk about the public health component of this bill, because it really ties into what we're seeing from providers that have been contacting us and what we're reading about in terms of the extraordinary measures they're having to take to deal with this crisis. I read an article this morning about how a lot of hospitals are concerned about, obviously this is not at the forefront of their minds because they're treating patients, but eventually the bill's going to come due here. And they have so many patients that are elderly, that are on Medicare, and they're requiring some intensive care for the treatment of COVID-19. They're requiring, 10 days in the hospital in the ICU, and that's very expensive. And Medicare doesn't reimburse, as we know, the kind of rates that hospitals like. And so there's a real concern about whether they'll be financially viable, especially those hospitals that are not as large and that are more rural based. So there's a lot of money in this bill to help them out. We also talked about this on our last webinar, but how a lot of doctors are coming back out of retirement to help try and sort of stem the flow of patients here. I just read today too that Massachusetts, and I'm sure other states are doing this as well, are allowing med school graduates to get their licenses now before having to even take a test, just temporarily to help with this crisis. So there's money for the various med schools and such in this bill as well. But it's a ton of money. We're going to really pick it through a lot more in the webinar. We'll talk about the other tax credits available to you as a business because they're relevant. But I wanted to bring that up. And Kelly, I think if you want to chime in here and just talk about the amount of questions that we've been getting about coronavirus over the past couple of weeks, is really astounding.
Yeah, definitely. From all of our different clients and different sources and different methods of bringing them in, we've gotten hundreds of questions already. A third of all the questions we've gotten in the month of March have been specifically related to COVID-19, which is crazy considering the ball really kind of didn't get rolling until the middle of the month when the first set of laws started passing. I mean, there was obviously hot spots in the country, so certain questions did start rolling at the beginning of this month, but it's astounding the amount of questions we're getting. Obviously, many more questions before the webinar, since I think we did an excellent job of addressing many questions on the webinar. And I think future webinars are obviously going to be in order because as the ball keeps rolling and things keep rapidly changing, we're definitely going to need to keep our tabs on this. Obviously, developments are ongoing on a daily basis. So definitely we'll be hearing a lot from us through all of our different media sources.
Great, yeah. And one thing I think we want to make clear here is, especially early on, a lot of clients are reaching out to us because various state insurance departments were taking action and passing regulations about, things that health plans had to cover in their state. And we were getting questions like, does this apply to me? What do we have to do? And I think at this point, now that we've seen the first recovery bill pass, the Families First Coronavirus Response Act, that was federal legislation that applied to ERISA plans and most of our industry for self-funded clients because it contained requirements that applied to them in terms of covering testing. But that said, there's still a number of things that at this point, it seems like every state is taking more and more action, both in sort of restricting the movement that people can do in the state and shutting things down, but they're also passing different laws. And Kelly, I think some of them might be relevant to our clients, even though they may not directly impact their health plans. I know you've been eager to talk about some of the things you've been seeing.
Yeah, definitely. There's a lot of things happening on the state and federal level from an employer perspective as well as a plan perspective. So it's going to be really important for employers as well as their health plans to watch the different rules that are happening and determine how they impact. Because certain laws, as we always know, sometimes vary depending on whether or not size of the employer. So, like even COBRA only applies to certain size employers. And when they're really small, a lot of the states have enacted mini COBRA laws. So the same things are happening with respect to these leave laws, as well as other types of requirements. So there's definitely a lot of interaction there. A couple state paid leave laws that have popped up recently are obviously one in New York. There's a quarantine leave law, and then Colorado also issued a health emergency leave with pay. The New York one is unpaid. Neither of these, when I look at them, are like super stellar when it comes to what they require, how long that leave is. It's pretty short. So the federal law is obviously, I think, going to catch a lot more and be a lot more comprehensive because these laws are pretty skinny, for lack of a better term, right now. And, it's possible that they might, reevaluate them and modify them based on, the fact that we don't know how long the situation is going to keep going. When it comes to things that relate to the plans, so when we talk about the waiver of cost sharing and copays and telemedicine and things of that nature, those types are more of like state health insurance mandates. And ERISA plans might actually obviously be preempted from having to comply with those, though they would have to pay attention to the federal laws. But non-ERISA plans are going to have to look at those individual laws to determine whether or not they first apply to the plan, as well as how they synchronize with the federal law and where the differences may be. And like you said, Brady, there's a lot of different states that have been popping up. Oklahoma, Texas, California, Washington, New York, all these states are doing things like that. And a couple of other, nuances that we're seeing with some of these to get a little bit more detailed. We saw one actually yesterday, a proclamation from the Washington state governor indicating that he wants to see a parity of payments for telemedicine services as opposed to face-to-face services. So he doesn't want insurance carriers and health plans that are subject to the law or the proclamation, I guess, for lack of a better term, because it's not a law yet. They don't want to see those types of treatments being paid differently. So they want kind of a synchrony across face-to-face versus telemedicine, since obviously most everything these days is switching to telemedicine as opposed to face-to-face when it can be done that way. A couple other things that we've seen on the state level is that we have seen grace periods for premiums. So they're allowing more time for individuals to pay premiums. I know California specifically require at least 60 days now. Oklahoma used to be 30, now it's 60. So those are also things on the state level to pay attention to. And I know that, Brady, you had mentioned previously that Medicare and Medicaid are also looking at different waivers of things as well. The Medicaid is going to be a state level. So those are interesting. We've also seen some marketplaces in different states holding special enrollment periods for uninsured individuals so that they can have health coverage during this time. Not really sure how that's going to interact on a global scale or if there's going to be more states that are doing that, but it's definitely interesting to see when it comes down to that.
Great. Yeah. I mean, I think the takeaway here, and, you know, this is really all still rapidly unfolding. We're going to have this situation with us for the foreseeable future. And a lot of these state laws and federal laws are really passing so quickly. I mean, as someone who follows this stuff, as I have for at least 10 years, it's really amazing when you start to see how quickly the gears of government can turn to get these things passed. And then we're quickly seeing the agencies fill in the gaps by posting FAQs, by posting other guidance on their websites. So sometimes the questions that we're getting, you know, don't have clear answers like on one day, but the next day there'll be some guidance issued. So I wanted to touch on one quickly before we wrap things up here. It's because it's a question we're getting a lot with respect to the first federal bill that was passed about emergency paid sick leave and the expansion to the FMLA. And so, as most of our clients will probably know by now, that bill applied to employers that had fewer than 500 employees. And there are a lot of employers out there, a lot of companies out there that are unsure exactly or were unsure how to count how many employees they had. What if you were acquired by another company? What if you were a smaller company that you were purchased by a larger one, and maybe with both of your employees combined, you may exceed the threshold of 500. There wasn't clear guidance readily available about how you should be counting. But just the other day, the DOL did post on their website an update, and it turns out that the way you count your employees, you have to look and see if you qualify as a joint employer. It has a lot to do with the FLSA, which is another federal labor law. So there is an answer to that question now. And I think the takeaway there is we're really operating on the fly with a lot of these rules as they come out, and there'll be more guidance filled in, which is also why you're seeing not just FIA, but other law firms and consulting groups are also doing regular presentations, webinars, and updates because things are moving so fast. And it's obviously very important that we provide the information that's accurate to our clients. So we're going to do that too. And so stay tuned for our future podcasts and webinars on this topic. We're going to have a continuing series on COVID-19 and the different impacts it's having up and down the industry. And hopefully we can all work together to get through this uncertain time. But in the meantime, do the best to provide for both our employees and our plan participants and really show how our industry can shine in tough times. So any last words for you, Kelly, on this?
No, I don't think I have anything else. I would just echo the sentiment that, you know, this industry as well as many other industries are moving rapidly and it's hard to keep up. I have many friends that are in HR that have now said that, you know, yeah, they're working from home, but they're working 80 hours instead of their normal 40 hours because they're just struggling to keep up. So for our clients, I would just ask for your patience, obviously, when it comes to answering your questions, because we will definitely get to all of them. And we're doing our best to do them as quickly as possible. But, you know, like we said earlier, the numbers that are coming in are outstanding, and they're all great questions, which is why our goal is to address hopefully a lot of them on our webinars and podcasts, just so that we can get the message to as many people as possible, because we know we all have the same questions. So keep the questions rolling in. We're obviously here to help and looking forward to working through this together.
Well said. Alrighty. Well, on behalf of myself, on behalf of Kelly, and our amazing remote producer, Pat the Man Santos, I want to thank you all for listening to our special edition podcast of Empowering Plans, and we'll see you next time.